Hello everyone, this is Alex from Swoosh English. Thank you very much for coming along to our OET Reading Part A class today. We always get a lot of requests from students to do OET reading and in particular reading Part A because a lot of students struggle in this area. This is the part of the examination that a lot of students find difficult with the speed element of it. Oh, I'm just going to turn it off on my Facebook Live on my phone, so I'm not hearing my voice back. So yeah, this is an area we're always getting a lot of requests from, so we want to cover that in detail today to help as many of you as possible. So anyone who's watching on Zoom right now inside the class with me, great to have you here. If you're not registered for the class and you want to actually come inside the class and interact with Alexander, our teacher, and myself, the two Alexes, then I would love to see you inside. But if you want to watch on Facebook as well, then that's fine. But it's better inside Zoom if you want to come inside Zoom. So that's what we are going to cover today. We're going to do some practice exercises. And let me know if you're interested in taking part in the exercises in the chat box, because the more you take part, the more you are going to get out of the session today. So we've got lots of people saying yes, they want to take part. No. Al Hassani, we've got Linda, who else have we got? Mohammed, Remya, Syed, Sylvia, Rafa, Usha, Shahana, Haida, Fahana, Grace, Ojo, Densi. Densi was one of our VIP students and is working very hard right now. So fingers crossed to you, Densi, when I'm looking forward to when you pass your examination. And speaking of examination results, I was really happy with all of the examination results we had yesterday, and I think some of those people might be coming on later to talk about their experiences. But yeah, we had a lot of people who passed their examination yesterday who are going through our Swoosh English VIP program. So I was very happy about that, and to pass on the results to all of our teachers so that they know about the successes of our students and the help that they have given them. So anyway, I'm going to introduce in a couple of minutes or so our teacher Alexander, but for the time being, can you introduce yourself inside the class today, whether you're on Zoom or whether you're on Facebook? Please introduce yourself. Are you a doctor? Are you a nurse? And also tell us when your examination is as well. Is it this month? Is it next month? The month after that? Please let us know in the chat box. Okay, so let's see who we've got. And all of the Prabha is one of our VIP students. Says, can you send me the link to get on Zoom? Prabha, you can go on to facebook.com/swoosh English. We've put the registration link inside there, so you'll be able to see it on and you'll be able to come inside the class. So just go to facebook.com/swoosh English and you'll see the link to register. So we've got Noor, Dr. Noor, who says she's got her exam on the 23rd of February. Musamat has got March. Arezzo, nurse. Shahana is a doctor. Linda wants to take part in the practice. Good to hear that, Linda. We want to give you as much practice as possible today. We've got Sylvia, who's a nurse, Sylvia Franklin. And Ajitha, he says she's ready. And well, I'm glad to hear that you're ready. We are ready to start going now. I think in the next couple of minutes or so, I'm going to introduce Alex into today's session. So if you've got your examination coming up, let us know. If you took your exam and unfortunately you didn't get the scores that you need, please again let us know in the chat box and we'll see how we can help you. We've got Dr. Arsan. We've got he's got his exam in March. Ajitha is a nurse from Saudi Arabia. Grace is a nurse. Okay, and okay, Mosamat. Okay, Mosamat's one of our new students. Good to see you, Mosamat. Nassim has got her exam in his or her exam in March, and lots of people interacting with us. Fantastic. So now, is everyone ready to get started? Please let me know if you're ready in the chat box. Say ready if you are ready. So right, ready in the chat box if you are good to go, as we say in the UK. Ojo, I'm a nurse from Nigeria and I've got my exam this month. It's my first time. Well, make sure you have effective preparation, Ojo. Fahana is a doctor. Lots of people saying ready. Okay, great. Jasmine, Pakshan, Arezo, Nasim, Noor. Okay, fantastic. So I am going to bring in our teacher, Alex, and we are going to get started. Remember to share the OET Facebook Live video if you're on Facebook right now, because if you share that, all you need to do is step 1, share it to your Facebook page. Step 2, right underneath this video, I have shared the OET live class video. I'm just going to change my camera. I've shared the OET live class video. That's step 2 underneath this video. And then we'll give you our free OET welcome pack with lots of video lessons on reading, writing, listening, and speaking. So reading, listening 2.0, as well as speaking and writing 2.0 will give you access to all of those materials. So if you want access to that, make sure you share this Facebook Live video so we can help as many students as possible with our free materials. We try to help students as much as possible with our free materials. And so if you've come on here today and you come on some of the other weeks, we always want to help as many people as possible. So the more you can share it to other people, the more that other people can benefit from these free classes as well. And the more you're helping people, and you're all medical professionals and you all came into this profession to help sick patients, etc. So again, you can also help your fellow colleagues and other students who are preparing for the examination as well. Okay, I am going to introduce Alex into the session, and let's see if he is here. Alex, if you can turn on your camera. I've made you co-host. You should be able to. Okay, fantastic. He's looking even more professional than I am today. Okay, which I'm not going to try and outdo him. He's beat me on that regard. Alex, I'm just going to unmute your microphone. Can you hear me?
Yeah, I can hear you. Yeah, how you doing?
Hi, Alex. How are you?
Yeah, I'm all right, thanks. I'm all right. Just protecting myself against the cold at the moment.
Well, it's so for anyone. So we always get doctors and nurses. Some people are living in the UK. But if you're not living in the UK and you're still in your home country or wherever you might be a Filipino nurse who's working in Saudi Arabia, for example, it's freezing in the UK right now. There's snow everywhere. I mean, Alex is in Nottingham. What's it like in Nottingham, Alex?
It's been minus. It was -5 at one point yesterday. I think it's a little bit higher than that now, but it's too cold. Yeah.
It's too cold. Well, I'm down in London, so I'm in the south of England, and it is cold. I went out this morning for some exercise and didn't stay outside for very long, 15 minutes maximum, then came back in, had a nice hot shower. So that's what I did today. So I am going to pass you over to Alex. Please let us know in the chat box if you've been taught by Alex before, if you're one of our VIP students, one of our paid course students, and you've been taught by Alex, or you've come to these Facebook Live classes before that we do free every Friday. Please let us know, and because we've had a lot of students, especially over the last few weeks, who've been saying that the classes have been really, really helpful and beneficial to them. So any of your comments can help new students who've come to this class who were not familiar with our classes and Alex's classes before. So we're going to help you as much as possible, and if you can give us your comments in the chat box as well. So Alex, I'm going to hand over to you today to run our Reading OET Facebook Live session and Zoom session as well. But yeah, for anyone who doesn't know you, Alex, can you just give us a brief introduction on your experience as a teacher and how you can help the students today?
Sure. So I've been involved in English language teaching for about 7 years now, in various countries, in China, Ecuador, and more recently in the UK. And I've been working with Alex and Swoosh in the OET exam for about the last 9 or 10 months. And I've been obviously teaching one-to-one classes as well as doing live classes. And I've also gone through the OET course in order to see how the exam is put together and what the sort of aims and goals are of the examiners in terms of what they want to see from candidates who perform in the exam. So that's what I'm going to try and focus on today, is kind of looking at what are some of the best strategies and techniques to use in order to give yourself the best possible opportunity to score a high grade in the exam.
Fantastic, Alex. And just for anyone who's coming over from IELTS to OET, the examinations are very, very similar, okay? Very similar in terms of the competencies and the things that they're asking you to do. So don't worry too much if you've only just come over from to OET from IELTS. they are very, very similar. So we will help you with that today. Alexander put together our reading and listening mock exams for OET 2.0. So he is the best person to be teaching you all about reading today. So I'm going to hand the class over to Alex now. Before I do that, make sure you share today's Facebook Live video to your Facebook page, and then we'll give you access to our OET free welcome pack. All you need to do is share it to your Facebook page. Step 2, underneath this video, say, I have shared the OET live class video. So I have shared the OET live class video, and then we'll send that free OET welcome pack with lots of video lessons straight to you. So I'm going to hand over to Alex now.
Okay, great to hear that so many of you are in the class today. That's fantastic. So yeah, as was discussed before, reading part A is what I'm going to be looking at in today's session. And what I've been doing recently is been sort of writing articles in relation to the OET, and in those articles looking at some different strategies and ways of approaching the different parts of the exam. So with reading part A, it can be quite overwhelming. You've got a lot of information which has been thrown at you. You've got 4 different texts. You've got 20 questions that you've got to answer in relation to those texts. And you only have 15 minutes in which to do all of that. So one of the first things that I think can be difficult for candidates going into this part of the exam is to decide, how do I approach this? Where do I start? So that's the first question that I want to ask today. For those of you who have looked at the OET Part A before, how do you begin? What is the first thing that you do when you receive that question paper? And it can be for those who've done the exam before, or for those who've just looked at practice papers. What do you do? Do you start by reading the questions? Do you start by reading the actual texts? What is your approach? So if you could share that in the chat, any comments in terms of what you personally do, it will be interesting just to see how different people approach this. And there isn't necessarily one correct answer to this, but it'll just be interesting to see sort of where you begin.
Absolutely, Alex. I'll tell you what people are saying on Facebook Live, and then obviously if you're a student on Zoom, then you can put in the chat box.
Cool. Okay, so we've got, yeah, so Jasmila scanning to start with. So I'm guessing scanning the texts to begin with. Starting with the texts. Okay. Yeah, so most people seem to be starting with the text. Oh, Danish is saying that they start with the question before looking at the texts. Interesting. Yeah, Nassim, scan all the text to know about the general ideas. Okay. So a few different approaches here. Is it similar with the live respondents as well?
Yeah, I'm just looking for responses. We've got a lot of people on Facebook Live. Let's see. Yeah, but if you're on Zoom, keep posting your how you approach this exam, this part of the examination. Okay, let's see. On Facebook Live, we got, Renith said skim and scan the text. Jelin said first read all the questions. Juliet, skimming and scanning. Yeah, starting with the question, said Aleb. Densi said the headline and the topic sentence. Check the headings of the paragraphs for Hannah. Read headlines from the 4 texts, said Shakir.
Okay. Okay, so a healthy amount of variety. Okay, yeah, I mean, as I said, there isn't necessarily one correct answer in terms of how to approach this, but what I'm going to put forth is a suggestion in terms of what can help in order to initially access the texts and also to make full use of that 15 minutes, because it's not a lot of time in order to answer those 20 questions. So my advice in terms of the best way to start is to begin with a skim, is how I've put it. And what I mean by that is that you want to start off by having a look at the texts. So for those who said what they do is they have a quick look at the headings or the topic sentences, I think that's a very sensible way to begin. Why is that? Well, the reason for that is because you're walking into that exam room, or you're just downloading that exam paper. You don't know what the topics are. You don't know what the questions are going to be. You don't have any idea. All you know is it's going to be based on a medical topic, but you don't know what that topic is. So if you start by skimming the texts in order to get a general idea, what that does is it starts to activate things like background knowledge. So if you're skimming text, for example, on how to put together some kind of wound care, some kind of sling for an injury, then straight away you can activate that knowledge and say, oh, okay, I know something about that. Maybe you've done that in your professional practice, or maybe you've studied that at some point, and some ideas start to generate into your mind. And what that helps you do is it helps you to make sense of the texts more quickly. Now, I'm a teacher. I'm not a medical professional. So when I look at things like this, it's really important for me to get a general idea as to what it is that I'm reading about before I even begin to look at the questions. And I think even for medical professionals, you want to be as specific as possible in terms of what the topic is before you actually start looking at the questions. If you look at the questions before you've looked at the texts, I think you've got an issue in terms of there's no context for any of the questions. And it's not helpful necessarily to look at the questions until you've got that context. So I think my advice on this is, yeah, to begin with a skim. Skim the headings, skim the topic sentences. Don't spend more than about 30 seconds to maximum 1 minute doing this. You're not reading through every single word. You're just getting a general idea of the texts. And then once you've done that, then you can go to the actual questions and you can make better sense of them because you've now got a context for them. So that would be my advice in terms of how to begin. Another reason why it's a really good idea to begin with a skim is because the first 7 questions for reading part A will all require a general understanding of the text. So I've seen here referencing to skimming and to scanning. Sometimes there's a bit of confusion in terms of what the difference is between the two. So I'll just sort of give a quick clarification here, just for those who maybe aren't sure about the difference. When you're skimming, you're reading very quickly just to get a general idea of the overall meaning and the overall focus of the text. When you're scanning, you're looking within the text for a specific word or a specific phrase. So the first 7 questions are going to be focused more on the skill of skimming, the skill of having a general idea of what the texts are focused on. And it's the next questions, questions 8 to 20, those 13 questions, which will focus on actually scanning, on finding specific pieces of information within the text. So if you begin with a skim, what you're doing is straight away, you're actually starting to read the texts in the sort of way you need to answer those first 7 questions. So we'll have a look at a little bit of practice later in order to see that the first questions are focused more on skimming, but that will be the way that I believe would be best to start in terms of your reading in order to make sense of the questions and to have the best chance of answering those first 7 questions correctly. So you've had a look at the text, you've begun, you've skimmed them, you've got the general idea, you've now started to answer those first 7 questions. What do you then want to start doing? Well, as I said before, questions 8 to 20 are focused on scanning. This is where you're finding the specific words or phrases within the text. Just bearing in mind, again, based on your own experience of doing the exam and what I've said thus far, how do you think skimming those first for those first 7 questions can help you with the next 8 to 20 questions? What can it save in terms of time? What do you think? Just to lay out the scenario again, you've skimmed the text, you've got a general idea. From that general idea, you've been able to answer the first 7 questions. From questions 8 to 20 now, it shouldn't be starting again. It shouldn't just be a case of going, okay, now I need to find specific words and phrases. Let me read all the text to find those phrases. How should you be able to use the first 7 questions to help you with questions 8 to 20? Any ideas? Again, just if you share them in the chat, then it'll be good to see what you think on this topic. See if anything comes up. Okay, so start from questions 8 first, I've got here. But now, yeah, now I want us to focus more on how questions 1 to 7 can help us answer questions 8 to 20. Okay. Not sure. Okay, so I'm not seeing a lot of responses coming up on here. Maybe this is something that we've not reflected on previously. I don't know whether in Facebook Live there's been any responses
Yeah,
there.
we've got Alex. We've got some people saying Bushra said giving information on that paragraph. The idea of content of each paragraph, said Syed. By doing the first 7 questions, said Farhana. Okay. So, yeah, some people are giving their thoughts and ideas.
Okay, good. Yeah, I've got Noor here who's saying the broad idea will help to determine the specific information, which is a pretty astute observation. Scanning paragraphs regarding questions. Yeah, perfect. Okay, yeah, we've got it. And so Elma, know which text the answer will be. Exactly. And Lynn is saying something similar. Orient me to the right text. Yeah, that's exactly what I was going for here, is that once you've got the general idea in terms of what the texts are about, once you start looking at the questions focusing on specific information, you should now have a good idea in terms of which text you need to go to. So let's have a look at an example here. So let's say you have text A, and you've decided that text A focuses on the general background and definitions related to a specific condition. Okay, let's say, for example, it's the condition of jaundice. Okay, so text A relates to the general background and the definitions. So let's imagine that question 8 says, jaundice is caused usually by, and then you've got a blank. Okay, so since you know that text A is focused on the general background and definitions, then that blank, you can be pretty sure, is going to be found within text A. So by having those answers to questions 1 to 7, you're basically saving your time. You're saving 75% of the time, because you can ignore 3 of the texts and focus on the one text where it's likely the answer is going to be. Sometimes you're not going to be 100% sure about the text, about which text you're going to be able to find the answer in. But those questions 1 to 7 are designed to help you orientate yourself in that way. That's why the questions are designed the way that they are. You're not supposed to go onto the specific information questions and then read through all 4 texts in order to find the answers to those individual questions. So you do want to be using those texts in that way, and you want to be looking at, okay, so what is the general focus of the text? It's on the background and definitions. Great. This is a specific information question asking me about background and definitions. So I will go to text A in order to find that answer. Just having a look at another example. Let's say that we're looking now at analgesics, for example. That's what the texts are focused on. And text C focuses on medication, how to apply medication, what the levels of medication should be. So you've decided that that's the general focus of text C. And then you have a specific information question, let's say for question number 10, which says, what analgesic should be used to give to a patient who is allergic to morphine? Okay. So in that case, you know that text C is focusing on medication, levels of medication. So in order to get that specific answer, you go to text C. And again, if you're able to do that, you're saving 75% of your time, because you're not having to go through all the texts in order to get to the answer. You already have a strong idea as to where you're going to be able to find the answer. And then you can go into that text and search for it. So that's why the questions are set up the way that they are. You're beginning with your skimming, and then you're letting that skim guide you forward when it comes to answering those specific information questions.
Alex, can you repeat how important that, can you just repeat that again? Because that was a huge tip that you just gave people about saving time, because this is the biggest reason why people say they struggle with reading part A. I want everyone to write this down, because it was a really, really good tip that Alex just said.
Sure. So we've begun with the first 7 questions, where we are reading the text in order to get a general idea as to what the texts are about. That's what we're doing for the first 7 questions. So again, let's imagine that the texts are about jaundice, and text A is looking at the background of the condition, and it's giving some definitions. So we know that. We know that's what the general focus of text A is about. So now, once we've done those first 7 questions where we've got the general background, we're now looking at questions 8 to 20 where we need specific information from those texts in order to answer them. So let's say that question 8 is saying that jaundice is usually caused by, and then you've got a space. We know that text A is focusing on the background and the definitions, so we will know that we need to go to text A in order to answer that question. Not going through text A, text B, text C, text D, because that's going to take 4 times as long. We can go to a specific text because we're confident about what the general background of that text is, and then it's going to help us to answer the questions from 8 to 20, which are looking for specific words and phrases from those texts. So that's what it's all about, saving time and saving, in a sense, 75% of the time that you would have used looking at all the different texts by using that knowledge that you've gained from doing questions 1 to 7, where you've determined what the general background is of each of those individual texts. So we will look at an example of this in a few moments as well. But this is the concept that I want us to focus on, because saving time obviously is really important for this part of the exam. Okay, so hopefully you've made a note of that, and that's something that you will bear in mind for what we're going to go on to have a look at very soon. So next point then. So we've done the skimming. We've now looked at the specific information in order to start answering the questions. Another tip, and this is a more straightforward tip, but it's very important, is that, well, okay, let me ask the question first of all. What happens in reading part A if you make a spelling error? What is the effect of that? Do you get maybe 50% of the marks? Or if it's a small error, do you still get 100% of the marks? What happens if you make a spelling error when you are answering the specific information questions? Okay, so Prab is saying there's no marks at all. Yeah, Tausif, lose the points, no marks, incorrect answer. Perfect, exactly. Good, yeah, so you're all aware of that. So in that case, then, you know how important it is to spell information correctly. This is different to the listening. In the listening, when you're writing your answers for part A, if you make a small spelling mistake, then you can still get the mark. But for reading, that is not the case. So you have to be really, really careful. When you find that specific word or phrase in the text, my advice is underline it. Because if you underline it, then it makes it much easier to refer back to it when you're answering the questions, and you can make sure that you spelt it correctly. Sometimes you're in a rush, you see it, great, write it down, you make a spelling mistake, you've lost the mark because of that small error. So if you underline that word, just very quickly underline it, and then you write it down. It also means that you can refer back to it very quickly as well. So if you do have any time at the end to check your answers, and you'll have done very well if you do, but if you do, then you can refer back to it just to make sure that you haven't made any small errors in terms of things like spelling. What happens if you start struggling? This is one of the things, because the time limit in reading part A is really essential to what reading part A is testing. It's testing what is called expeditious reading, being able to read things at speed. So for those of you who are good at maths, how much time should you spend on each question on average? You've got 20 questions, you've got 15 minutes to answer those questions. How much time for each question?
I'll see what everyone's saying on Facebook Live, Alex.
Yeah. We've got some different maths coming up. We've got 2 minutes suggested. 30 seconds, another suggestion. Yeah, Nora, I usually only answer 16 of the questions in 15 minutes. If you're answering 16 correctly, then that'll be enough to get you what you need. Okay. 1 to 7, only 5 minutes.
Farhana said 40 seconds. Shakir, first 7 questions takes 5 minutes. Bushra, 1 to 2 minutes. Sun, 40 seconds.
Okay.
Some varied answers. 80 seconds said Vanessa.
80 seconds, okay.
40
okay,
seconds,
so,
yeah, lots of answers.
A lot, yeah. I'm seeing a lot of sort of coalescing around 40 seconds, 45 seconds. Yeah, I mean, that's right. So, straight maths, if you divide 15 by 20, 15 minutes, 20 questions, 45 seconds essentially is what you got on average for each of the questions. So there might be some questions you're able to answer a bit more quickly. Some questions might take a little bit longer, but essentially that is what you're looking at. Now, of course, as Danish is saying, you're not going to time your answer to every single question. That's not what I'm saying. But what I am saying is if you sense that you're beginning to spend a long time on just one question, that's a problem. Because if you're spending, let's say, 2 minutes on one question, what you're doing is you're taking away the possibility of answering 2 other questions. So what do you do in that case? And again, yeah, of course, you're not going to be looking at the clock for every single question that you answer, but you're going to get a sense of it, right? You're going to get a sense, because 45 seconds, what does 45 seconds feel like? It should basically feel like looking at the texts, going through, either doing your sort of general skim, title, topic sentence, getting a general idea, okay, and then writing your letter, or it should be sort of searching within a text, searching. Okay, right, okay, and then starting to get your answer, because you've also got to take the time to write down your answers as well. So if you find that you're searching for what seems to be quite a long time, then you've got a bit of a problem here. And what do you do? What do you do? You're spending 2 minutes on one question. You haven't found the answer to that question yet. What do you do? My advice would be, in this case, would be to actually skip the question. If you're taking a long time on one specific question, then all you're doing is you're basically robbing the time that you could have been spending on other questions. Questions 1 to 7, you want to get an answer to them, and essentially it's multiple choice, A, B, C, D. So don't skip any of those. You do want to answer those questions. But once it comes to questions 8 to 20, then there may just be one that for whatever reason you just can't find. It's just not sticking out for you. Don't be afraid of skipping that question, moving on to the next question, and then if you've got any time at the end, going back to it. So it's all about answering as many questions as you can. And let's imagine, for example, question 14 is just really difficult. You're just not able to find it. But then questions 15 to 20, you would have been able to answer them had you had enough time. But you don't get the opportunity to answer them because all the time has gone. So you need to be a bit strict with yourself. As I say, questions 1 to 7, yeah, answer all of those questions. It's either A, B, C, or D. It's general point, general focus. You should be answering those questions. But once it comes to questions 8 to 20, there may be a moment where there's just one specific question which you can't find the answer to. Move on. Move on to the next one. You don't have to answer all the questions in order. All the questions are worth the same number of marks. So it doesn't make sense to spend lots of time on one question and then not have the opportunity to move on to the following ones, okay? So don't be afraid to skip if you're really finding a particular question difficult.
Absolutely, Alex. I've had a question from Amna Khan on Facebook. I can answer this one. Amna Khan said, it's a very tough mental exercise with regards to reading part A. I find myself frozen sometimes. Please, can you give some advice on how to overcome that? I mean, it's the same with anything that you have to do very, very quickly. I mean, doing the practice in in those kinds of those high stakes scenarios where ideally you're doing the practice not in the real exam scenario because you're paying $500. You don't want to use one. Some students use one exam. They use one exam as their test. They call it their test exam just to get familiarized with it. That's $500. You don't want to pay $500 to test out your skills and going in there into the exam thinking you're not going to pass, but it doesn't matter. I'll pass on my second attempt. You'd rather have some proper practice, okay? So keep getting the practice in is what I would say, Amna. I mean, we offer our benchmark exams and our mock exams that Alexander's put together for us. I could tell you more about those later, or I'm sure some other good teachers and other good schools offer those as well. But a benchmark exam will tell you what level you're at. You can get that practice. It can be a timed exam as well. So, for example, our exam has got a timer on the top right-hand corner. So it will literally stop the exam as soon as it gets to 0. So those kinds of scenarios will help. Of course, a lot of practice materials. If you've got a course that you're part of, that would help a lot. And also, I would say something that's completely out of the box. It would be something like meditation. helping you to be calm under pressure in those high stakes pressurized scenarios. So so a little bit of meditation. I always recommend Headspace, 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 all one word. Go on Google. It's a free app for meditation. I would tell you to try with that. I don't know. Have you got any advice on that one, Alex?
Yeah, I mean, I echo all of that, absolutely. And I think also the sort of stuff we're doing today. So if you've got a plan, I think the reason why you freeze is because you've got no plan. Again, you're just seeing 20 questions, 15 minutes, 4 texts. What do I do? The thing is, if you've got a plan that works, then you can use that in the exam room. So if you go in and you think straight away, right, I know what I'm doing. I'm going to skim through these texts. I'm going to get a general idea. Okay, yeah, I think this is focusing A. I think this is B. I think this is C. Great. And then I'm going to use that to help me orientate myself for this specific information. If you've got that plan and you put that into practice by doing the mock exams, as Alex was saying, that at least gives you a strategy. So you're not going in there completely blind. You've got this experience. You've done this before. You know how it works. And you can take that with you into the exam room. If I went in there and saw that as a native English speaker, I would be shocked by it. I'd be like, my God. In fact, I was when I did it the first time, because I had to do it for the practice course. And I was like, oh my God, rushing. And so, so you want to have a strategy, have as much practice as possible. And that helps you in terms of being prepared psychologically.
Exactly. My sister Claire, she's a nurse in the northwest of England. So she's very lucky because she didn't have to take an English exam to become a nurse in the UK. Of course, she's a native speaker, but I think about her, if she went in and tried to do a reading part A, she'd be like, what can I do? It's a very difficult exam. It would be difficult for a native like Alex and myself and my sister Claire, and it's difficult for you. So, all of the advice that Alex and I have given would help you in that scenario. Any other questions have got coming through? And I should say as well, some people are asking, how do they get inside this Zoom class with Alex and I and all the other students where we can give you more support? I put the link inside the Facebook Live. So if you want to join us in here, then just follow the instructions. And I put it in here at swooshenglish.com/free class. And you'll be able to join us in the session. The other thing I'll say is if you want our free OET welcome pack, then all you need to do on Facebook, share the Facebook Live class link to share the Facebook Live video to your Facebook page, step 1. And then step 2 is you right underneath this video, I have shared the OET live class video. And then we will send you your free OET welcome pack with lots of video lessons, everything free, lots of tips and strategies that we can also provide you as well.
Okay, so absolutely, yeah, it is a challenging part of the test, but stick with it. And my final point, actually, funnily enough, and it's really already been covered, is practice. The sorts of strategies that I've been talking about today are not going to come naturally to you until you've put them into practice, until you've used them. So when you're doing the mock practice tests, don't just do the mock practice tests and come and approach it in any fashion. Try and approach it in a focused fashion. Try and actually put into practice some of the things that I've talked about today and see if that works for you. And it should do, and it should hopefully help to increase your scores. So talking about practice then, let's actually do some. So I'm just going to share some exercises with you now. They're based on the format of reading part A, but it's not reading part A. It's just some exercises which are designed to orientate you towards reading part A. So I'm just going to share this with you now on my screen. Okay, so here is a text then, which hopefully you should be able to see. And it's just here, where you've got your heading here, and then you've got your text underneath. So this is the sort of short text which you could imagine being presented with in reading part A. What I want you to do, just very quickly, is to have a look at the text and then tell me which of the 3 options, A, B, or C, you think it focuses on. So does it focus on A, the definitions and background of an illness, B, information relating to a medical procedure, or C, information relating to detecting the symptoms of an illness? So what do you think? Just put
Alex,
it in the chat.
Sorry,
yeah.
you can zoom in a little bit? I'm just wary of some people watching on their mobile phone. If you can zoom in at the top. Yeah, a bit more.
A bit more, okay.
Yeah, that should be okay. Yeah, perfect. Yeah, that should be good.
Okay, nice. So what I'll do is I'll just I'll just copy quickly A, B, and C into the chat so that you can see the options there. Let's bring that up. Okay, so some of you are giving responses already. Some of you are putting B. I've just put it into the chat again, just in case you didn't see it on the screen before. I'm sorry, I'll just, yeah, okay. Just so you've got that there. Okay, lots, yeah, pretty much everybody is saying B. We've got one C there, but most people are saying B. Just remind myself here. Okay, so good. Yeah, so most people then are saying B, information relating to a medical procedure. So a lot of you here have been giving responses very quickly on that. What information did you have to read in order to come to your conclusion? So B is correct, I should say, first of all. Well done for detecting that so quickly. What information did you need to read from this text in order to come to that conclusion on B? People have talked about things like topic sentences. You know, how many words did you need to read? How much detail did you need to go into in order to get that answer of B? Let's see. Okay, topic sentences, title. Okay, some specific words, craniotomy. Yeah, topic sentence and subheading. Okay, absolutely. So the texts for reading part A are all going to have some kind of heading, some kind of, or if not heading, at least some kind of subheading, which kind of breaks down what the text is about, or some kind of topic sentence, which gives you a clue as to what the text is about. So straight away here then, you've got the guidelines for performance of surgery in case of subdural hematoma. And, you know, surgery obviously is a medical procedure. So straight away, just from looking at the heading, you're getting a really strong clue as to what the general focus of the text is. So just reading that heading and then just having a quick look at the topic sentence in order to get a sort of idea as to what the text is about. This is what we're talking about when we're talking about skimming. So you skim through the text, you get a good background in terms of what the text is about. So now, when it comes to the specific information questions, if you get a specific information question which is focusing on aspects of the medical procedure, you can be pretty confident that you want to go to this text in order to answer those questions. So let's have a look then at another question. And it's going to be, just because of the size, it's going to be a bit difficult to see the question and the text at the same time. But at the moment, you can see the questions. So we're looking at these questions here. So I will share these questions in the chat so that you can see them here. Okay, so 3 questions. Just before you answer these questions, what kinds of questions are these? Are these the skimming questions for questions 1 to 7, or are these the scanning questions which would come up in questions 8 to 20? What do you think? Again, just share your answers in the chat. Okay, so Danish is saying scan. Any other offerings here? 8 to 20. Nassim is saying skim. Nassim is scanning. Okay, so we're getting a little bit of variation in terms of the answers here. Yeah. Okay. Most people are saying scanning. So yeah, these are scanning questions because now you have to find specific words or phrases in the text in order to answer them. It's not a question of choosing text A, B, C, or D. Those are the skimming questions. The scanning questions are where you're going to have to read within a specific text in order to find that word or phrase. So just having a look at the text again. So I've brought this up. Can you answer those 3 questions? And I'm going to give you a minute in order to answer them. Okay.
You heard the man, 1 minute. That's what the kind of time limit you would have for questions in the real exam. Exactly.
And especially because this is easier because you've only got one text that you can that you need to consult. So 1 minute. Let's see how we do. Okay, got about 15 seconds remaining. Okay, so that's your minute. So let's see what we've got then. So for question number 1, which procedure needs to be conducted under evidence of a subacute hematoma? What have we got here? Let's see. So we've got some that say craniotomy. Where are the questions on Facebook? Okay, so the questions, I did put them in the chat there, but I guess on Facebook, yeah, you wouldn't have seen them, sorry. So these are the questions. So which procedure needs to be conducted under evidence of a subacute hematoma? So some on the chat here are saying, yeah, craniotomy. I've got burr hole as well. That's what Ritza is saying. Christine, craniotomy. Okay. Okay, so a little bit of disagreement on burr hole and craniotomy here. But let's see then. So which procedure needs to be conducted under evidence of a subacute hematoma? So remember, again, this is where we're scanning. We're looking for specific words. So let's see what it says about craniotomy. Should be performed in the majority of cases where an acute subdural hematoma is evidenced. What did the question say? Well, the question was actually looking at subacute hematoma. So if we have a look here, what about burr hole? Should be performed in the majority of cases where a subacute or chronic hematoma is evidenced. So for those who put burr holes, you were correct. So here we are. We know which text we're looking at because there's only one text to go through. But when we're scanning, we need to really make sure that we found the correct answer. This is why I gave the advice before about underlining. Okay, so you underline it. You underline your where you found the answer in the question paper, just very quickly, just draw a line, and then you write it in. At the time, because you've got to obviously do this very quickly, you may just put in your first answer and keep going. However, if you do get any time at the end to check, if you've underlined it, you can just quickly cross-reference and see if you are correct. Also, if you answer the question really quickly in, let's say, sort of 10, 15 seconds, remember, you still have another 30 seconds just to double check your answers. So for those who did double check and made sure that they put burr holes and not craniotomy, well done, because you got the mark in this case. Number 2, which procedure usually requires the use of general anesthetic? Let's see what people have said here for number 2. Okay, so 2, craniotomy. I can see here, yep, and Hind is saying craniotomy as well. Okay, great. So, we've got one person who spelled it graniotomy. So remember, that might have been a typo, but remember in the real exam, correct spelling. It has to be correct spelling in order to get the mark. And it is the craniotomy because it says here, operation typically conducted under general anesthetic. Which is a paraphrase because it says here which procedure usually requires the use of general anesthetic. So you've got typically paraphrased for usually, but you've got the specific information here because that's talking about the craniotomy. And finally, number 3, what is used to help resecure the skull following a craniotomy? Okay, well, we know here is a craniotomy. We're scanning. Let's see what some of the answers were. Metal plays and screws. Again, be careful with those typos. Is capitalization important? Not unless it's a proper noun. If it's a proper noun, then you should spell it with a capital. So, for example, if it's the name of a person or a place, but otherwise, then you can write in lowercase. So you don't need to worry about that. Okay, so metal plates or screws, perfect. Yeah, exactly. So you can see here then, here is the answer. To re-secure, that's been paraphrased for reattached, and there is the answer, metal plates or screws. It's often the case with part A that if you get one of 2 options, that will be enough. So if you just put metal plates, that would usually get you the mark, or if you just put screws, that would get you the mark. Metal plates or screws, you put them both together, then you're definitely going to get the mark. So there you go. So that's the difference then between the skimming and the scanning. And if you've got a clear idea of which text you're looking at, then it makes it much quicker to scan and find the answers. I gave you 1 minute to give those answers, and a lot of you in the chat were giving me those answers, 3 answers in the case of 1 minute. So, it can be a much quicker process if you know which text you need to be focusing on. Okay, so here we are. That was the text. We've got a little bit of time, so I just wanted us to do to have a quick look at an official exam paper, just to have a quick look at questions, the first questions 1 to 7, which, as you've correctly said, you should be answering within the space of about 5 minutes. Okay, so remember, you're reading it, you're beginning with a skim, you're getting a general idea, and from there you're going to go on to answer the questions 1 to 7. So what I'm going to do is I'm going to share the link for the texts here on the chat, and then I'm going to bring up the questions on my screen. So let me just share the link for that now. Okay, so just click on this link and it will bring up some questions for part A. Okay, and you should be able to get that without any issues. And on the screen here, I'm going to share the actual questions. Okay. So just let me know in the chat when you've been able to access that page. Hopefully all of you should be able to do so.
Yeah, I can see it, Alex. Yeah, if you just zoom in a bit.
Okay. Let's see. And I'll bring that down. Maybe a little bit more.
Yeah, a bit more, yeah. Yeah, perfect, yeah.
Cool. Would the Facebook Live students be able to click on the link?
Yeah, I can give that link to them.
Perfect. Okay. So as discussed, looking at the questions to begin with, each of these questions then from 1 to 7 is focusing on the skill of skimming through the texts in order to get the answers to the questions. So for those of you who are able to access the texts, you can start to have a look at those now and to skim through in relation to those questions. So that would be the first thing that you're doing. You're skimming the texts, having a look, very, very quickly, just so you know what the topic is. And then you're going to go to the questions and you're going to skim again in order to put the correct letter next to each of the options. So, yeah, if you're able to access those texts, then just have a go at doing that now. Skimming through, remember the main things to focus on, the headings, any other information. It could be sort of the graphical information could be pretty clear. If it's looking at if there's graphical information, that could be on medication levels. It could be on things to do with timing, which could give us a good idea as to what the main focus of the text is. So 5 minutes to have a look at those different texts in order to answer these questions.
Thanks, Alex. A couple of people on Facebook Live saying they can't open the link that I put inside. I always tell people every week that sometimes if you're on a mobile phone, sometimes you can't click the link. For example, if I try to click this link on my mobile phone, it doesn't work for me. However, what you can do is you can copy and paste it into the browser, or you can watch on a laptop or PC, and you'll definitely be able to open the link there. But if you're on a phone, you have to copy and paste it onto the browser that you have. So it depends on the phone that you have, if it's an Android or an iPhone, etc. I hope everybody is taking part in the exercise. It's really important to get the practice. So please make sure you take part.
Absolutely. Practice makes perfect. Sorry. Okay, 1 more minute, guys.
I think we're going to have to go through the correct answers now, Alex.
Okay. All right, let's have a look at that then.
Time.
Okay, no worries. Let's have a look. So just having a look then. So some of you have been able to answer all of the questions, which is fantastic. And we have just had 5 minutes. So it's a good time to review that. So Dempsey, I'll just have a look at yours here because I can see them just ahead of me. A very good response here. So if you can all see what Dempsey put, she did a very good job. Just one small error. Okay, so D, number 1 was D. Number 2 actually was C. So if we just have a quick look at number 2, the precise levels of paracetamol in the blood which require urgent intervention. So precise levels. In this case, we have a nice little graph we can see in text C for those who are having a look at it. And that is telling us about the levels in terms of paracetamol in the blood. So we've got obviously the normal treatment line and the high risk treatment line. So having a look at that graphical information in terms of relating it to levels could have helped us there. So number 2 was C, and she was correct in the sense of saying that number 3 was B, number 4 D, number 5 A, number 6 B, and number 7 C as well. So for those of you who are able to answer those questions very quickly within those 5 minutes, that is fantastic. And looking at those texts to get a general idea is what you should have been done in order to help you. Just having a quick look at one example. So number 1, where it talks about various symptoms of patients who have taken too much paracetamol. Then, sorry, I've just put the wrong answer there. So 2 should be C. Yeah, so I've just put the answers in the chat again, but for number 2, it shouldn't be B, number 2 should be C, so I've just corrected that underneath. But if we just have a quick look, number 1, the various symptoms of patients who've taken too much paracetamol. If you go to the text, and if we're looking at text D, then it says clinical assessment, and then you have it very nicely bullet pointed. It's got things that I can't pronounce, but I can pronounce renal failure, lactic acidosis, and so straight away you're looking at these different symptoms which could come up relating to paracetamol. So this is what the sort of thing that you're looking at when you're skimming through the bullet points very quickly, the headings very quickly. So well done to those of you who scored highly in that. And remember, if you're getting 5 or 6 out of 7, then you're still on course mathematically to get a B or above.
That's great, Alex. Well, you mentioned Dempsey. I'm not surprised that she gave some good answers, great answers rather, because she's one of our VIP students. So she's obviously doing her she's doing the work. She's understanding the theory and she's putting it into practice. So well done, Densi. She's very, very hard working.
Yes, evidenced.
Evidence, absolutely. So thank you very much, Alex. And Alex will be sticking around for questions, etc. So he will, if you've got any questions whatsoever, then feel free to ask them now. Densi said, yes, I'm doing my best. Well done, Densi. Okay, but yeah, if you've got any more questions, feel free to let us know. Like I said, we'll happily help you as much as possible. Okay, so let's see what questions are coming through. Okay. Okay, so if you've got any questions, I'd love to help you as much as possible. So we've obviously, I actually want to know, to start off with, so far, has the class been helpful today with your reading part A? Please let us know in the chat box. Has it been helpful to have the theory, understand how you approach reading part A, how much time you should allot to each question, and also how you make most effective use of your time? Excellent, said Rita. Rita's one of our VIP students. Riza, yeah, we can't cover reading part C today, but Prabha, you're one of our VIP students, so you've got access to your video course. You've got access to the live classes. So the live class is going to start in about 25 minutes, Prabha, for our paid VIP students. So make sure you go to those classes, and they will be very, very helpful to you. The mock exams are very good, said Densi. It's very helpful. Well, that's great to hear that all of our mock exams are helping you. Let's see what people on Facebook are saying. It's been very helpful, said Ojo. Okay, great to hear that. I want to ask a question, actually. Does everybody know what their OET level is right now? Okay, so if you're at the beginning of the OET journey, then the answer will be no. If you're going to take your exam later this month or next month or the month after that, do you know what your level is right now? Do you know if you're at a C or C plus or a B in reading, writing, listening, and speaking? Let us know. Say yes if you know what level you're at, and no if you don't know what level you're at, because it's really, really important to know what level you're at right now. Because guess how much? Can anyone tell me how much the OET exam costs? Can anyone tell me how much the OET exam costs? I'm giving you a big hint. Can anyone say in the chat box? Okay, I really want to know who knows what their level is right now. Okay, Jassine says, no, I don't know my level. No, says Reneth. Yeah, so Maud is right. So it's 500 US dollars, 587 Australian dollars. It's a lot of money, okay? It's a worthwhile, valuable exam to take, but we don't want you taking it 2, 3, 4, 5 times. We want you to pass first time. And a lot of students do not know what their level is. Vanessa, no. Syed, no. Juliet, no. Reneth, no. Mariam, no. Lots of people saying no, they don't know their level. So if you're going ahead and booking your exam and you don't know your level, you could go into the exam and your level is a C or C plus, or even 2 Bs and 2 C pluses, and then unfortunately you don't pass. And guess what you have to do next? What do you have to do next? The second exam, you have to pay another $500. It's a lot of money, everyone, and we don't want you spending lots and lots of money when you don't actually know your level. Like our VIP students like Densi and Prabha and all these other people, they know their level because they're getting writing corrections from our teachers. They're doing our mock exams. They know their level. Okay, so what we've done is, I'm really excited that it's going to help a lot of people, is we put a very, very affordable, very cheap OET benchmark examination together on our learning platform. You can take it anytime, and it's only $20, okay? So $20 in order to invest in yourself, to make sure you know what your level is, so you don't need to pay $500 again and again and again. So we put this together with the help of Alexander, who was our teacher today, and we put this reading, writing, listening, and speaking exam together. And this will allow you to know what level you're at right now, know how much time it's going to take you to pass your examination, because we'll give you recommendations at the end when you get your answers. So when you get your answers, you know what, sorry, you get your scores immediately, you know what score you got, and then you can compare the answers you got correct and incorrect with the actual answers, and then we'll tell you, like I said, where you need to go next. Is it going to take you 1 month of preparation, 2 months? How long will it take you with a teacher, and how long will it take you without a teacher? So we want to help as many people as possible, and that's why we've kept it really, really cheap, because we know some of you are living in countries where the salaries are not so high, and you're desperate to pass. Maybe you can't afford our courses and our classes, but you want to see what your level is. So if you are really, really interested and curious to know what your level is, then this could be the thing that could help you out a lot. And like I said, we want you to save your money. We want you to pass first time, ideally, if we can. Okay, so this examination, if anyone wants to hear more about it, say yes in the chat box. I'm literally, of course, if you're just here for the free class, then that's totally fine. But I just want to tell a few people who might need something like this a little bit more about it. So I've put that into the chat box on Zoom. So that's our benchmark examination. I'm going to post it on Facebook as well. So if you do want to look at that, then I would highly recommend you to look at it. Like I said, we kept it really, really cheap as possible, because like I said, I want people to understand their level, but and also I don't want you to be spending lots and lots of money on the examination. Okay, so I'm just going to share my screen to quickly show you what that looks like. Okay, so this is the benchmark exam. It will help you, like I said, to understand your level and tell you when you should be ready to take your exam. Or you've got your examination results yesterday and now you don't know why you got a C or C plus in reading, writing, listening, and speaking, and you want to know what you can do to improve. So this is what you'll see on the page. So like I said, learn when you should take your OET exam, get a score on all 4 areas of reading, writing, listening, speaking, save time, money, and energy on having to take the exam many, many times. And also you can take the test anytime, anywhere, and get your results immediately after taking the exam. We'll give you the opportunity to test under exam conditions. So it's a timed exam. So the time will run out if you use too much time, for example, in reading part A, and then we'll give you an analysis in a video course at the end. Alexander will give you an analysis of where you went well and where you went in the right way in terms of the answers and your approach, and where you went down the wrong path with your incorrect answers, so you can compare that with the right and the wrong answers and see what you can do to improve moving forward. And then we said we'll give you recommendations on what you can do to improve your performance and get you to your 4B target as soon as possible. So that's $20 on our website. I've posted the link in there. I won't mention too much more about that, but it is available on our website now, and lots of students have been benefiting from it. So like I said, detailed exam on all 4 areas, recommendations, how you should prepare for the exam moving forward, and our analysis videos. So that's it. And thank you so much for coming along to our class today. If you've got any questions for me about how you should approach your OET exam, what you should do moving forward, okay, and you know, really how best we can support you here at Swoosh English, because we want you to pass. We want you to achieve your dreams of becoming a doctor or nurse in the UK. It really hurts me when I get these emails from people saying, I took my exam, I didn't pass, I can't achieve my dreams now, I've got a job offer in the UK, I'm waiting to pass my exam, and I don't know what to do next. Please, please, please help me, I'm desperate. These kinds of situations, I don't want them to happen in future. I want people to go ahead, take their exam, pass first time, and then move on and forget about English completely. That's really what we want. And we've had so many of our doctors and nurses who passed their exam yesterday, and I'm so thankful, especially 2 women in particular that I'm so happy that they passed, and that's Sharina, who's an Indian nurse who's in Saudi Arabia, and also Blessy, who is her friend, and she passed as well. So I'm happy about those 2, but I'm also happy about so many other students who've passed their examination. There's far too many to mention. So well done to Sharina, well done to Blessy, and well done to all the other Swoosh English students who passed their examination. So thank you very much for everyone. Some people are asking about the OET benchmark exam. $20, yeah. So you can go ahead, take the exam whenever you want. There's no expiry on when you need to use that. Okay, so if you buy it now and you want to use it 1 month later, then you can do that, no problem. Okay, because we want you to know what your level is. We want you to know it so you can go ahead and book the exam when you are ready. Okay, so if you're getting B's in our benchmark exam on all 4 areas, then go ahead and feel confident that you can go ahead and book your exam and take it soon. And you can walk into that exam with confidence. The problem is a lot of students are not going in there confident. They're nervous because they don't know their level. If you don't know your level, how do you know if you can get a B? Okay, it's like, for example, it's like running 5 kilometers when you're trying to prepare for a marathon, which is 42 kilometers. If you're just practicing like that, then you're not doing the practice, then you're not at the level of what it takes to become a very, a highly elite professional runner. It's the same thing. You need to be at running 42 kilometers or running close to that in order to actually be able to run a full marathon. Okay, it's the same thing. So you need to know what your level is. So if anyone wants to ask any questions, they can join me on the free class here on Zoom. I've just posted the link on Facebook Live. But if anyone else has got any other questions, then I'm more than happy to answer them. So people have got questions here on Zoom about the benchmark exam. Like I said, it's $20. It's very, very cheap compared to the OET full exam, $500. So if we can save you money and time and energy, then I'd love to do that. Anyway, thank you very much for everyone on Facebook Live. I'm going to be staying here on Zoom, trying to help some students and answering some of their questions. But for everyone on Facebook Live, I hope if you've got your exam tomorrow, I hope and pray that you pass your exam. So fingers crossed for everyone who's got their examination tomorrow. I hope you pass. And the other thing I should say, if you're on Facebook, keep sharing the video. We'll give you access to our free OET welcome pack. So share it to your Facebook page. Step 2 is you write underneath the video, I have shared the OET live class video. Thank you very much, everyone, and all the best if you've got your exam tomorrow. Okay, so we've gone on Facebook now. If anyone who's watching on Zoom, Talis said, is it one-time use only? I mean, you wouldn't want to take the exam 2 or 3 times, Talis, because you already know the answers. So it's better if you do it once only, because it's better for you to understand your level right now. But we are looking at soon of potentially giving more options to people. So if you want to take it 2 or 3 times, then we can definitely see how we can do that. Okay, for you. But at the moment, yeah, for 1 attempt, it's $20. We might try and give another price for 2 attempts or 3 attempts. Pak Shan said, thank you very much, Alex. You're very welcome. Danish, I think Danish, you took our mock exams before. Danish Mohammed, I recognize your name. Let me know. And let me know, what did you think of the mock exams? Did they help you? I hope they did. Okay. Tausif, yeah, I'm sorry to hear about your results, Tausif. I know you didn't pass, but I'm sure with a lot of hard work and energy on your part, as well as our support, we can help you with your examination. Thanks so much for your helpful advice, Linda. You're very welcome. Okay, we've still got quite a few people here. I'm struggling writing. Be careful, Danish, because there's some issues with your writing. In here is writing, W-R-I-T-I-N-G, and it's struggle, not struggles. Yeah, all B. So I think writing is your issue. Then, yeah, oh, okay, don't worry, Danish, typo error. So Danish, if you've ever had a teacher, if you've had a native English-speaking OET teacher helping you before with your writing, let me know if you've had that before. Linda said, I'll come back soon for a mock test. That's great. Yeah, Talsif, sorry to hear that. 300, not too far away from 350, but yeah, more work needs to be done. Talsif, were you spending at least 45 minutes on the corrections from reviewing the corrections from our teacher for every single letter? Be honest with me, Talsif. Did you spend at least 45 minutes? Because that's what will help you a lot. If you can review all the grammar mistakes you made, you see the grammar mistakes, you can go on Google. After you see those mistakes, you can see the difference between them and then understand them. or you've got a grammar book. So that kind of thing is really, really important. But not just that, of course. Also, okay, yes, I did, but I didn't write letters every day. Well, it's not just about writing every day, Talsif. Like I said, it's about reviewing the letter corrections that our teacher gives you, okay, and then learning from the mistakes and studying it. And then, like I said, if it's grammar books or vocabulary, or if you go back to our theory in the video courses, even if you've watched the video courses, then you can understand it again and again and again. Masamit said, I've already bought your live video lesson. That's great, Masamit. Masamit, when he says, I don't understand how to access it, well, the good news is for you, Masamit, we actually give you an instructions video link inside your email. Okay, so I don't know if you're on Gmail or what, but check every folder. Sometimes it goes to your spam folder, but we give you the confirmation emails. Make sure you use the same, okay, you're on Gmail. Make sure you are looking in the same email that you used to buy the course, because sometimes people have two email addresses. The email that you used to buy the course, check that email, check promotions tab, primary tab, spam tab, and it will be in there. And inside there, we've got an instructions video about 3 minutes long. It's very easy because we show you step by step how you do everything. Okay, step by step, where it will show you how to do everything. Click here, click there, and you'll be able to access all of your video courses, Masamit. So please try that and let me know if that works for you. But like I said, okay, great. Well done, Masamit. Okay, no, I'm not going to comment on other competitors, okay? Like I said, I'm talking about, I think we might be asking about our OET benchmark exam. Okay, this is our own exam here at Swoosh English that we put together. Don't confuse it with another company's products. Regarding writing some case notes are too long, again, I'm not sure whose case notes you're referring to. Okay, Danish. I got a B after assessment. Does that mean you had a teacher helping you? I don't know. You need to let me know. Who else? We've still got quite a few people here. Who've we got? Amrit Pal, Anitha, Asma, Danish, Dr. Gergia, Aries Mendoza, Elmer, Fazana, Hani. Some of you have not been taking part in our lesson today. You've just been watching. I want you to take part. Hui, Hani, Elmer, Aries Mendoza. I've not heard from any of you. So please, please make sure when you come to these classes, please make sure you get involved in the classes. Leah, good to see you, Leah. Hopefully you've restarted your study. You know, we'd love to help you to pass. Mabo, Linda, Marissa, Nokia, Rabab, Sarah El Sheikh. Sarah, I think you've got your exam this Saturday, have you? And fingers crossed that you pass your exam, Sarah. We've been working hard with you with your OET preparations. Okay. Okay. So Dane said he got his writing. Was it a native English speaking teacher? Let us know. Was it Australian, American, English? Is it UK? Because it's important to have a native teacher in terms of not just my response and feedback, but a lot of other students. They say it really helps a lot. Okay. So it definitely helps a lot. Okay. Fantastic. So you're very welcome, Masama. Okay. Yeah, Danish, I can't comment on other companies, but what I would say about Swoosh is that we're giving a lot of feedback. We've got let me see. Actually, Sarah, I want to find out from you whether when your exam is and how we can help you, because I saw that you've been in our monthly program and you're active in our WhatsApp group as well. Let's see, Sarah. Hello, Sarah, are you there? Hello, Sarah, can you hear me? Sarah, hello?
Yes.
Hi, Sarah, how are you?
I'm fine. Do you hear me?
I can hear you, Sarah. Sarah, when's your exam? Is it tomorrow?
No, I didn't book. I'm still waiting for my marking results. has been taken so long time.
Yeah, such a long time. I agree. It takes a long time to
Yes,
get remarking. That's why.
yes.
Which area did you fail in?
Well, I got 300 in writing.
Okay.
That was my
So
problem.
right. Okay. And so, how long ago did you ask for remarking?
Well, I asked for remarking on 21st of December.
Oh wow. Okay. So it usually takes
Yes.
about 6 weeks. So you should receive it probably next week.
Yes, it should be next week. Right.
Okay, good. So I've got my fingers crossed for you, Sarah. I hope they change the score for you
I
from
hope so.
300 to
I hope so.
350. I mean, I have heard of people getting those increases before and remarking, but sometimes they don't. So
Yeah.
let's see what the OET do. Okay.
Yeah,
Okay. So
exactly.
Sarah, as well, before you go, for any students who so you've been on our monthly program. Did you what did
Yes.
you think of the program? Anything that you think you could advise other students about it? Do you think it would help them, etc.? And be as honest as you want. If you think it's rubbish, then say. But if you think it's good, then also you can say as well.
No, no. Actually, Swoosh English. One of my friends, Sumaya. You know Sumaya?
So Maya, she passed with us. I think, did she? Samaya?
Yes,
Hello,
she
Sarah?
passed. Yes, she
Oh,
passed
yeah, she
from
passed.
yes, from first
Okay.
attempt.
First attempt, she passed with us. Fantastic. And
Yes,
so she was the one who told you.
yes. She told me about Swoosh English, and there is unlimited writing corrections. There is also video courses, stuff like this, and it's really helping. Um, I've been, this is about the life classes. It's very helpful, really. It's one of the, it's, I advise people more about life classes because when you participate, you get more, um, you can understand more of the idea of the questions and what's the real what they are asking for in the question, like in part A, B, C, whatever, and listening, reading, and it's very helpful.
Okay, that's great, Sarah. I'm glad it has helped you a lot because that's essentially, we want you to pass as soon as possible. So let me know when the remarking results comes through. Just send me a message because I'll be waiting to hear.
Yes, of course.
All right, Sarah. So you're still coming along to the classes, yeah? You're still doing the hard work that's needed to pass the exam, yeah?
Um, yes, I'm taking like an off for these days.
Okay, keep going
I'm
though,
getting
Sarah.
nervous.
Keep going, okay? And let's wait for your results to come back.
Yes.
All right, Sarah. I'm glad you enjoyed the class. All the best.
Thank you.
Take
Thank
care.
you.
Bye. Okay. So lots of people say people saying Fazana said thank you. It was a very useful class. Thanks a lot, said Anitha. Jasmila said, do you have any centres in East London? No, we're a world centre, Jasmila. We're online. Okay, so I actually do live in East London. Okay, but of course we have a lot of students, we have hundreds of students, and they are from all around the world. So we do these kinds of classes on Zoom, and like Sarah said, the live classes were very beneficial for her. But if you can't afford live classes, of course, like I said before, we've got a benchmark exam that just costs $20 because we want people to know what their level is. So for anyone watching right now, please don't go ahead and take your exam. Don't book your exam if you don't know your level. If you don't know your level, don't book your exam because it's a gamble. It's like going to Las Vegas and you're rolling the dice and you please hope to get, red 13, black 11. You can't gamble. You can't risk this because it's a lot of money. It's a lot of time. It's a lot of energy. If you've got a job offer, they have to wait longer. as well for you to pass. So then if you go ahead and take the exam, you don't know your level, and then you get C's and C pluses, then you have to take the exam again and then pay again. So that's what really we want to avoid. We want to avoid people doing that as much as possible. And that's why, like Sarah said, her friend Samaya joined our program and passed first time. So she's saved a lot of money from having not to take the exam again and again. So $20, okay, I know there's some students on here who don't like paying for things. They don't like buying courses. They just want to pay for the exam. $20 is very cheap, okay? And if it stops you from booking the exam when you're not ready, then I think that's worth the money. You've saved $500 then. So any last questions people have got before we end the session today? And I'm here, who said, Fazana said, I'm here, Alex, but the time difference is here in Canada and getting prepared to go to work. Okay, Fazana, well, it's very early in Canada now, so well done for coming on the class, coming to the class so early in the morning. But other than that, everyone, has anyone got any last questions before I go? And please let me know in the chat box. Okay, but the link to get the OET benchmark exam, I'll put that in the link again, and you can have access to that. Like I said, it's $20 to check your level and see if you're ready to take your examination. Danish, do you offer private sessions? Yeah, we do offer one-to-one classes. So we've got teachers like Alexander and our other UK OET teachers. Those classes are 49. Well, sorry. You get all of our video courses, all of our writing corrections. You get 10 one-to-one classes all for $590. So $590 for all of that. We would give you our benchmark exam and our mock exams included as well within that. Okay. But of course, we've got cheaper packages. Just go to swooshenglish.com. If that's not something that you can afford. But of course, some people prefer private one-to-one classes because they can get a lot more support and there's no other students inside the class. But Danish, yeah, if you've got any questions about that, just send an email. Fasan said, I plan to take the Swoosh English study package, $99. How can I get my letter correction? Well, $99, Fasan, is a very, very cheap price. So we can't offer letter corrections for that price. It's too cheap. I mean, we try to give our video courses and our mock exams for that price. But yeah, if you want, I think we give 5 letter corrections for $99. You can go on our website, but if you're looking for kind of unlimited corrections, you'd have to join one of our packages, which are more than $99. But if you just wanted 5 letter corrections, then you can book that and order that on our website. Okay. So I think that's pretty much it. And if you've got any more questions, just send us an email. Okay, send us an email to support@swooshenglish.com, and we'll be happy to answer your questions on that. So support@swooshenglish.com. Just make a note of that email address. And for everybody who has come along today, thank you so much for coming in. And like I said, Sarah, make sure you tell me your remarking results when you get your results next week. And for everyone else watching, thanks very much. Have a great weekend. Keep studying hard. Keep working hard.